Other reasons that dentists may tell a patient they're not a candidate for implants is the amount of bone that they have. They just don't have enough bone available because the sinuses are larger than normal, or the patient has gone a long time without teeth and that bone has just started to resorb. Another reason is just the procedure itself, that they're looking at something like doing a single tooth implant or an implant bridge, and they may not have the bone in that location, but that doesn't mean that other techniques would not be able to take advantage of the bone that the patient has. So at Nuvia, we have several techniques that we could take advantage of to use the bone that the patient has and also to add more bone. Some of these include like zygomatic implants. So a zygomatic implant is a very long implant that takes advantage of the bone in the zygoma. So the zygoma is more the cheekbone. So the implant is screwed into the bone just like any other implant, but it's much longer. A sinus lift, it's generally needed when the sinuses, they pretty much grow, and them growing is actually the absence of bone. Large sinuses, we do sinus grafting. There's a couple ways to do this. We do variations of those to build up the bone in the sinus area, and that's mostly for premolars and molars on upper back teeth. And so when we lose, especially upper back teeth, when we lose those teeth, pretty quickly that bone starts to shrink down and get very thin. Doing a sinus lift actually allows me to go inside, cut a little window, and actually add bone into the sinus to bulk it up, so that then we can place an implant in that bone after the bone attaches and remodels and grows in the sinus. So you're able to place bone where there wasn't bone previously, which allows you to place an implant where previously you may have been told that you are not a candidate for implants. It's all done intraorally, so there's no scars or anything on your face. It's all done in your mouth. Use bone that isn't being utilized and isn't needed and really would have been removed anyway. We grind that bone up, and then we use that bone along with the patient's blood with PRF. PRF is platelet-rich fibrin, and so that's the good stuff that we take, the good, healthy, healing properties of the blood. We separate it, take it out, and then we could use it as a liquid. We can smash it down and use it as a membrane to suture over the top of a graft that we place to kind of hold the graft in, and it brings all these nice, good healing properties to the area to help you to heal much quicker. A lot of times when there's just not enough dense bone on the solid bone, we could take advantage of using bone that's further back. It's called the pterygoid, but that's a super dense bone, and we're able to angle implants, move them all the way back there, and so then you're able to have back teeth, and that's probably the most difficult part in any implant placement is those back teeth, because those, especially the upper back, loses bone so quickly. When you're able to place a pterygoid implant, it's a nice solid bone, and so you're able to bridge across from the front to the back and have those big, strong, grinding teeth. And to have that supported by the pterygoid plate is very beneficial. So that's beneficial because every time you take out a tooth, you're going to lose bone around that area. So the sooner that you're able to put a graft in there, your body absorbs the graft, kind of reworks everything and builds a scaffolding itself to replace the bone that is missing.